welcome back to another video. Welcome to our channel. Remember, if you are new to this channel, please to go ahead and click that subscribe button and turn on that post notification bell so you won't be missing any of our videos whenever we upload. Guys, September, however, is Prostate Cancer Awareness Month. And so, since we're in the month of September, I decided to do a video speaking or educating persons or just making persons aware that yes, this condition affects many men, right? Many of us are, most times, we do not speak about conditions that affect our men. Most time we tend to sit on the females, like we always be talking about endometriosis, heavy menstrual bleeding, cervical cancer, breast cancer, but most times we don't take that time out to speak about prostate cancer that really affect our men. And so, as I said before, today I'll be speaking about prostate cancer. Yeah, we'll be talking about prostate cancer. Yes, guys. So first, we're going to look what is cancer. Now, cancer is when abnormal cells start to divide and grow in an uncontrolled way. The cells can grow into surrounding tissues or organs and may spread to other areas of the body. So basically, cancer is when the cells just start to behave abnormal. They start to mimic. They just start to behave in a way which is not usual. Now, prostate cancer. Prostate cancer is a cancer of the prostate gland. Right? Prostate cancer is cancer of the prostate gland. Now, where is the prostate and what exactly does it do? Now, the prostate is effectively a very large gland, and it sits between the bladder and the urethra. We all know that the urethra is the pipe work, right? So the urethra aids in removing urine from the body, right? Yeah. Now, what does the prostate gland do? Now, the prostate gland, it produces fluid that washes semen and keeps the sperms healthy for successful fertilization, right? So what it does, it aids in successful fertilization, which we know how men stay about the part they are them body, and them stay, them always tend for the whole rest of men when it comes to that part of the body. Now, what happens when cancer develops in the prostate and where does it grows? Now, it usually begins with the edges of the prostate. It can occur in more than one place, right? So it can occur other than the prostate gland. Now, it usually begins within the edges of the prostate and can occur in other areas, in more than one areas. Now, first it starts to grow inside the prostate, and when it gets advanced enough, it starts to grow in the lining or the edges of the prostate. Good. Now, we all know that this is a cancer that affects mostly men. It doesn't affect our women. Now, it is a saying, well, there is a saying that says the older a man gets, then it's more likely for them, or they're more at risk to get prostate cancer. Yeah, yeah. So the older, I think the age that most men start to test for their prostate, I think it's like age 55. Yeah, I think they start. A man can start testing for cancer at age 55. Yeah. So now, who are at risk? The men. All the men are at risk. So as I said before, the older you get, the older a man gets, the more likely they are to develop prostate cancer. Now, so age is a risk factor, ethnicity. So mostly black men. It affects mostly our black men. Yeah. So and also if there's a family history like the man father or his brother, close relatives has that history of prostate cancer, and also if there's an history of breast cancer within a person's um, family, yeah, the men tend to get prostate cancer. No, also we know like lifestyle factors also contributes to many conditions, lifestyle factors. So like drinking a lot, smoking, and some persons with diabetes they tend to get prostate cancer also. Now Um, sometimes we might hear or medical doctor or persons speak about PSA. Now, this is the term PSA means prostate specific antigen, and this is one of the tests doctors use to diagnose prostate cancer. Okay. Now, what are some symptoms of prostate cancer? So, prostate cancer, the person might not have any symptoms. Most times, there are not really any symptoms that might show blood like that. So, most prostate cancer tend to start in the outer part of the prostate glands. So, this means to cause symptoms, the cancer needs to be big enough. So you might hear persons speak about enlarged prostate cancer or the enlarged prostate gland. Now, when this gland is enlarged, then you might find that persons have difficulty urinating. They have urgency, like they always want to pee, they can't hold the pee. Persons, which is a man, because we know only men has or can experience prostate cancer. They might be seeing blood or they might be seeing blood in their semen or their urine, and also like there's difficulty in the flow of urine. So instead of like they won't have a normal urine flow then. So is either it is too heavy or it is too little, or they can't urine at all. So when that happens, then as I said before, when these signs or symptoms occurs, that means the prostate gland is being enlarged. So when persons start seeing these symptoms, then they have to see their general practitioner, which they might send them to do tests to see what's happening down there. Are there any treatments for prostate cancer? No, guys, the treatment depends on a number of factors, and this includes how big the cancer is, whether it has spread to other areas or areas of the body or just your general health. So sometimes the treatment might involve surgery, hormone therapy, or radiotherapy. And now, guys, we know most persons tend to be adopting the natural sides, natural ways of treating certain conditions. So, some natural things that can be used to treat prostate cancer, which most of us are familiar with, is the saw palmetto, right? So most times you might see your grandpa or uncles when they reach certain age, them now leave out them saw palmetto. Also, the next thing is the pumpkin seed oil, which both male and female can use that. So we know most persons, they tend to just have it parch the pumpkin seed. Yeah, we can find that in our herbal stores or pharmacies and also in our supermarkets, and we might see like our cashew man and stuff. Our peanut man sell also the pumpkin seed. So yes, guys, so the saw palmetto and the pumpkin seed is a natural way which is used to treat and prevent enlarged prostate. Also, stinging nettle. I'm not sure if any of us are familiar with nettle. Yeah. And also lycopene. No, lycopene are pigment found in red fruits and vegetables. So like our tomato, yes, our tomatoes are rich in lycopene. So this is good for prostate cancer. And also zinc and vitamin D. Yeah, and we all know that zinc and vitamin D is also good for the immune system. A lot of persons are using it in their treatment for COVID-19. So see, the one item can be used for more than one condition, right? Yes, so or saw palmetto or lycopene or pumpkin seed and vitamin D, zinc and nettle are some natural stuff that are good for prostate cancer. So guys, I know this video was very short. I hope we all learned something, and I hope you can share this video with someone else for them to better understand prostate cancer and how it affects our men. However, guys, prostate cancer, a man that has prostate cancer tends to live long as they find out early and start to get the proper treatment. Yes, so yeah, our men tend to live long with prostate cancer. Most men, they don't want to do the test. Most men don't want to know that they have prostate cancer, because we know how our men are, especially our Jamaican men. Yes, they are very skeptical about that part of the ear, and they don't want to say anything is wrong down there. So yes, guys, thanks for tuning in again. Thanks for always watching. Please remember to share, like, subscribe, comment, and until next time, bye.